Alright, welcome parents to another video. I hope everyone is doing good. God bless you and your children and your whole family as well. So in today's video, we're going to talk about why we're not seeing progress in children with developmental delay and autism. I get this question very often during my consultations because I get to meet the new parents every time I do my consultations. So usually the parents go to therapy for like a lot of years, and most of them don't see much progress with their children with therapies. Few parents are pretty new. They don't ask me this question, but I pretty much get this question very often. But why do we not see any progress with children with autism? First, we need to understand the disease pathophysiology, how the disease is progressing, what is the cause behind this disease, what is really happening inside the body. Because some kind of infection happens inside the body, that's when we would have symptoms externally. So in order to stop the symptoms externally from outside, we need to fix the pathophysiology inside. So why do we not see much progress with children with autism? So here, children on the autism spectrum or developmental delayed children, they have oxidative stress. So what does oxidative stress means? Loss of oxygen to the cells inside the brain and body. So it's very basic. So when the cellular damage happens basically at 1.5 years old, that's when we usually start seeing these symptoms. Before that, the children's usually be like a typical children's. A lot of children speak, they'll be more like a normal babies. But when they turn 1.5, that's when the disease will start progressing. That's when the cellular damage happens inside the brain. Primarily, it happens in the cerebellum region and medial temporal cortex. That's where we see a lot of oxidative stress. And what about the other parts? Yes, most of the parts in the brain are pretty much normal. The healthy cells, we see little hyperactive areas, the red and blue areas. If I'll show you a picture here, so you can understand how that PET CT scan works. So little hyperactive areas, pretty lot of normal cells. So when there is so much cellular damage, and especially in the cerebellum and medial temporal cortex, basically the primitive reflex gets retained. That's first happens. And cells in the brain has very weak cells. So blood supply is very less. And what about the cerebellum, the small brain? It pretty much it pretty much has like neurons there, 60% of the functioning neurons for the brain. So out of 100, 60% of the brain neurons are pretty much in the cerebellum region. That's how the brain works. So what happens when there is a lot of cellular damage in cerebellum? 60% of the whole brain functioning isn't going to stop. That's why the speech is affected. That's why the child gets very moody, emotional dysfunctioning, sensory dysfunctioning. Why does sensory issues occur? The brain is activated and uses sensory system, input and output. That's how brain works. So repetitive behavior occurs because of Brodmann's area 6, which is pretty much very imbalanced in the right side and very dominating on the left side. So in order to fix this oxidative stress and cellular damage, we have to work on supplementation. So best supplementation to go for, also consult your doctor before going for these supplements, because it's better to go for your pediatrician, consult with your pediatrician as well. So CBD oil is one of the best things that you can give to reduce the inflammation, because the receptors inside the brain are cannabinoid receptors. In order to make a lot of healthy connections with the neurons, we need good amount of CBDs, because cannabinoid receptors will help us to make a lot of connections. Second thing is omega-3 fish oils. Brain requires omega-3s. For the brain to function properly, we need good amount of healthy fats, and we get that from omega-3 fish oils. Next is we have to also fix the gut. Why the gut? Because brain and gut have the axis. And we can also see a lot of children with developmental delay and autism, they have gastrointestinal dysfunction. What does that mean? Constipation, gastritis, acid reflux, so many things goes on. So we see a lot of constipation. Few children don't have it, but most of the children do have it. So in order to fix the gut, we give prebiotic inulin. If the child is pretty allergic to prebiotic, we go for probiotic. So we know how to change that. And then we have to have 1-to-1 ratio of omega-9s and 3s, which is extra virgin olive oil. So these are the 3 supplements which I suggest. It's also called Nemechek protocol. It's primarily given for children with autism and developmental delay, whoever has systemic inflammation inside. So these major supplements we use, and CBD oil is one of them. So also consult with your pediatrician before giving the supplements. Make sure you to do that. And next thing is, this is a brain disorder. Primarily it's affecting the brain. Here we are working on the brain as well in the therapy. When we do the therapy, we need to work on the root cause. Only when we work on the root cause, we can actually work on the problem itself, rather than just focusing on the symptoms where we just do in conventional therapies. So how do we work on the root cause? The brain's foundation is primitive reflex maturity. The reflexes in the brain needs to get matured. Only that happens, the sensory system will start working properly. Alright, what about next? Next is postural reflex. That's when the child will attain all the eye contact, ocular motor control, hand-eye coordination, balance, coordination, and after that attention focus, speech, language system, auditory skills, then cognition skill, executive functioning, reading, learning, mathematics. This is how it works. Why does primitive reflex maturity is very important here? Because that's the foundation of the brain. Only when the reflex is matured enough, it's integrated, the brain will start functioning 100%. But if it's retained, like children with autism or developmental delay, basically the brain is not working, it is having a big imbalance. So in order for the primitive reflex to get matured, we need to integrate it every single day. So what does American Speech Association say? In a day, we need to give treatment for 3.5 hours. So in a week, we need to give total of 24 hours in a week of treatment for children with autism and developmental delay to attain the best results. So let's put it this way, you go to therapies, so you take both OT and speech, that's like 45 minutes, one session, 1.5 hours, and then you go back home, repeat the same thing what they did in the therapy setup. So you're basically like treating your child per day 3 hours. And the next week increase the intensity, make it 3.5 hours. And work your way through, and in a week you should attain 24 hours. Trust me, if you follow the supplementation protocols and 3.5 hours of treatment every single day for your child, you will see good amount of results. Very, very good amounts, because you're working on the root cause. Next is you're working on the primitive reflex. That's like more than enough for your child. You would see tremendous amount of results. But there are few children who don't see much results. Those are very, very rare, because we have to understand when we work on the root cause, even a child is 7 years old and the brain maturity happens at 6 years, we will still be able to change the results. Who doesn't see the results? When we don't work on the root cause, when we don't give supplementation, when the inside part is not healed enough. If inside is not working properly, the external symptoms will never go away. For the external symptoms to go away, we need to treat the inside first, and later the external symptoms will stop down. So I hope this video was very helpful, and the parent who asked me to elaborate this more, I hope this was helpful for your parent as well. So I'll see you guys in the next video. Take care. Always work on your child for 3.5 hours per day. It will really help you. Good luck.